Activities like drawing, painting, or crafting allow children to express their feelings visually. For example, a child might draw a picture of their family to express their feelings about family dynamics. Role play. Children act out different roles or scenarios, which helps them process their experiences. For example, a child might pretend to be a teacher to explore feelings about school. 4. Thérapeutique technique. Play therapists may use specific techniques to guide the process, such as reflective listening. The therapist listens and reflects back what the child is expressing through their play. This helps the child feel understood. Limit setting. The therapist may set boundaries during play to help children learn about rules and consequences, which can be helpful for managing behavior. Storytelling. Using stories or puppets to facilitate discussions about feelings and experiences can help children articulate emotions they may struggle to express directly. 5. Goals of play therapy. The main goals of play therapy include helping children understand and express their feelings, develop coping skills for managing stress and anxiety, improve social skills and relationships with others, resolve trauma or difficult experiences in a safe environment. Applications of play therapy. 1. Emotional issues. Play therapy is effective for children dealing with various emotional issues, such as anxiety, depression, or grief. It provides a safe space for them to process these feelings. For example, a child who has lost a pet might use play therapy to express their sadness and learn how to cope with their loss. 2. Behavioral problems. It can also help address behavioral problems, such as aggression or defiance. By exploring their feelings through play, children can learn better ways to express themselves and manage their behavior. For instance, a child who acts out at school may use play therapy to understand the underlying emotions driving their behavior, leading to positive changes. 3. Trauma and abuse. Play therapy is often used with children who have experienced trauma or abuse. It allows them to express their feelings about these experiences without having to talk about them directly, which can be difficult. For example, a child who has experienced domestic violence might reenact scenarios with toys to process their feelings about safety and fear. 4. Social skills development. Play therapy can help children develop social skills, such as sharing, cooperation, and communication. Through play with the therapist or other children, they can practice these skills in a supportive environment. For instance, a child might learn to take turns while playing a game, which helps improve their interactions with peers in real life. Conclusion. In summary, play therapy is a valuable therapeutic approach that uses play as a means for children to express their emotions and experiences. By creating a safe and supportive environment, therapists can help children explore their feelings, develop coping skills, and improve their relationships. Understanding play therapy will be beneficial as you prepare for your CPC exam and explore various methods of supporting children's mental health. Sure, let's explore applied behavior analysis, which is a scientific approach to understanding and changing behavior. What is applied behavior analysis? Applied behavior analysis is a therapy based on the principles of behaviorism, which focuses on how behaviors are learned and how they can be changed. ABA uses techniques and strategies to improve specific behaviors and skills in individuals, particularly those with developmental disorders like autism. The primary goal of ABA is to increase positive behaviors, decrease harmful or undesired behaviors, and teach new skills that can help individuals lead more independent and fulfilling lives. Key concepts. 1. Behavior and environment. ABA is based on the idea that behavior is influenced by the environment. This means that behaviors can be changed by modifying the environment or the situations that trigger certain behaviors. For example, if a child throws tantrums when they don't get their way, ABA would look at the environment and the circumstances leading to those tantrums to find ways to change the situation. 2. Reinforcement. One of the key techniques in ABA is reinforcement, which involves providing a reward after a desired behavior occurs. This encourages the individual to repeat that behavior in the future. For example, if a child cleans their room and receives praise or a small reward, they're more likely to clean their room again in the future. 3. Positive and negative reinforcement. Positive reinforcement involves adding a pleasant stimulus to encourage a behavior. For instance, giving a child a sticker for completing their homework. Negative reinforcement involves removing an unpleasant stimulus to encourage a behavior. For example, allowing a child to leave the dinner table after finishing their vegetables. 4. Punishment. ABA can also involve punishment, which is meant to decrease undesired behaviors. This can be done through positive punishment or negative punishment. For example, if a child misbehaves and loses access to their favorite toy as a consequence, this is a form of negative punishment. 5. Data collection. ABA relies heavily on data collection to track behaviors and measure progress. This involves observing and recording specific behaviors over time to understand patterns and the effectiveness of interventions. For example, a therapist might track how often a child engages in a specific behavior, like speaking in class, to see if the number increases after implementing a reinforcement strategy. Applications of ABA. 1. Autism spectrum disorder. ABA is commonly used to help children with autism develop essential skills, such as communication, social skills, and daily living skills. It can also help reduce challenging behaviors. For instance, a child with autism might learn to use words or pictures to express their needs instead of resorting to tantrums. 2. Behavior modification. ABA can be used to modify a wide range of behaviors, such as improving academic performance, increasing attention in class, or reducing aggression. For example, a teacher might use ABA techniques to encourage students to raise their hands before speaking, rewarding them with praise when they do. 3. Parent training. ABA can also involve training parents and caregivers to use behavior modification techniques at home. This helps create a consistent approach to managing behaviors across different settings. For instance, parents might learn how to use positive reinforcement to encourage their child to complete chores or homework. 4. Social skills development. ABA can help individuals improve their social skills, such as making eye contact, taking turns, and engaging in conversations. These skills are essential for building relationships and interacting with others. For example, a therapist might use role-playing activities to teach a child how to start a conversation with a peer. Conclusion. In summary, applied behavior analysis is a powerful therapeutic approach that uses scientific principles to understand and change behavior. By focusing on reinforcement, punishment, and data collection, ABA helps individuals, especially those with autism and other developmental disorders, learn new skills and improve their behaviors. Understanding ABA will be valuable as you prepare for your CPC exam and explore various methods of supporting individuals in achieving their goals. Sure, let's explore positive psychology, which is a branch of psychology that focuses on the positive aspects of human life and what makes people thrive. What is positive psychology? Positive psychology is the scientific study of what makes life worth living. Instead of only focusing on mental illnesses or problems, it emphasizes understanding and promoting positive emotions, strengths, and overall well-being. Positive psychology aims to help people lead fulfilling lives by fostering happiness, resilience, and personal growth. Key concepts. 1. Well-being. Well-being is a central concept in positive psychology. It refers to a state of happiness and satisfaction in life. This can include emotional, psychological, and social well-being. For example, someone with high well-being might feel content with their life, have good relationships, and have a sense of purpose. 2. Positive emotions. Positive psychology emphasizes the importance of experiencing positive emotions, such as joy, gratitude, hope, and love. These emotions can improve overall well-being and life satisfaction. For instance, practicing gratitude by regularly reflecting on things you are thankful for can increase feelings of happiness. 3. Character strengths. Positive psychology identifies and promotes various character strengths, such as kindness, creativity, courage, and perseverance. Focusing on these strengths can enhance personal development and happiness. For example, someone who identifies their strength of kindness might engage in volunteer work, which can boost their mood and sense of fulfillment. 4. Resilience. Resilience is the ability to bounce back from challenges and adversity. Positive psychology studies how individuals can develop resilience to cope with stress and setbacks effectively. For example, someone who faces failure at work might use resilience to learn from the experience and try again rather than giving up. 5. Flow. Flow is a state of complete immersion and engagement in an activity, where a person loses track of time and feels a sense of fulfillment. This often occurs during activities that challenge a person's skills but are still enjoyable. For instance, an artist might experience flow while painting, becoming so absorbed in their work that they forget about everything else. Applications of positive psychology. 1. Personal development. Positive psychology can help individuals identify and build on their strengths to achieve personal goals and improve their overall quality of life. For example, someone might take a strengths assessment to discover their top qualities and then set goals that align with those strengths. 2. Mental health. Positive psychology can complement traditional therapies by focusing not just on reducing symptoms of mental illness, but also on enhancing overall well-being and happiness. For instance, a therapist might incorporate positive psychology techniques, such as gratitude exercises or mindfulness practices, into their sessions. 3. Workplace well-being. In the workplace, positive psychology can improve employee satisfaction and productivity by fostering a positive work environment and encouraging strengths-based development. For example, a manager might create a recognition program that highlights employees' accomplishments, boosting morale and motivation. 4. Education. Positive psychology can be applied in educational settings to promote students' well-being, resilience, and engagement in learning. This can lead to better academic performance and overall happiness. For instance, schools might implement programs that teach students about mindfulness and emotional regulation to help them cope with academic pressures. Conclusion. In summary, positive psychology is a branch of psychology that focuses on understanding and promoting positive emotions, strengths, and overall well-being. By emphasizing well-being, resilience, character strengths, and positive emotions, this field encourages individuals to lead fulfilling and meaningful lives. Understanding positive psychology will be beneficial as you prepare for your CPC exam and explore various methods of enhancing mental health and happiness. Sure, let's explore self-determination theory, which is a psychological theory that focuses on motivation and personality, particularly the importance of intrinsic motivation. What is self-determination theory? Self-determination theory is a framework that explains how people can develop motivation and personality through their experiences. It emphasizes the role of intrinsic motivation, which is doing something because you find it enjoyable or fulfilling rather than for external rewards like money or praise. SDT suggests that people are most motivated when they feel autonomous, competent, and connected to others. Key concepts. 1. Intrinsic motivation. Intrinsic motivation refers to engaging in activities because you enjoy them or find them meaningful. This type of motivation is driven by internal rewards rather than external ones. For example, a student who studies a subject because they find it fascinating is intrinsically motivated, while a student who studies only to get good grades is motivated extrinsically. 2. Basic psychological needs. According to SDT, there are 3 basic psychological needs that must be satisfied for intrinsic motivation to flourish. Autonomy. The need to feel in control of one's own actions and decisions. For example, a person may feel more motivated to complete a project when they have the freedom to choose how to approach it. Competence. The need to feel effective and skilled in what you do. When people feel competent, they are more likely to engage in activities and persist in the face of challenges. For example, a musician who practices regularly may feel a sense of competence as they improve their skills, leading them to play more often. Relatedness. The need to feel connected to others and have meaningful relationships. When people feel a sense of belonging and connection, they're more motivated to engage in activities. For example, participating in a group sport can fulfill the need for relatedness as individuals bond with teammates. 3. Autonomous versus control motivation. SDT distinguishes between different types of motivation, which can be categorized as autonomous or controlled. Autonomous motivation. This includes intrinsic motivation and extrinsic motivation that is internalized. It means you engage in an activity because you value it or believe it's important. For example, someone might volunteer for a cause they care about because they find it meaningful. Control motivation. This involves engaging in activities for external rewards or to avoid negative consequences. For example, someone might study hard only to avoid disappointing their parents, which is a more controlled form of motivation. 4. Impact on behavior. When the basic psychological needs are met, individuals are more likely to be intrinsically motivated, leading to greater persistence, creativity, and overall well-being. Conversely, when these needs are not met, motivation can decrease, and individuals may feel disconnected or disengaged. For example, a workplace that encourages autonomy and offers opportunities for skill development is likely to have employees who are more motivated and satisfied with their jobs. Applications of self-determination theory. 1. Education. SDT can be applied in educational settings to enhance student motivation and engagement. Teachers can create an environment that supports autonomy, competence, and relatedness to foster intrinsic motivation. For instance, allowing students to choose topics for projects can increase their sense of autonomy and motivation to learn. 2. Workplace. In the workplace, SDT can help improve employee motivation and job satisfaction. Employers can create a supportive environment that fulfills employees' psychological needs, leading to higher productivity and morale. For example, a company that allows flexible work hours and encourages skill development can help employees feel more autonomous and competent. 3. Personal development. Individuals can use the principles of SDT to enhance their own motivation and well-being. By identifying activities that fulfill their psychological needs, people can pursue goals that are more aligned with their intrinsic motivations. For instance, someone who enjoys painting can make time for it regularly, fulfilling their need for creativity and relatedness if they join a local art group. Conclusion. In summary, self-determination theory is a framework that emphasizes the importance of intrinsic motivation and the fulfillment of basic psychological needs, autonomy, competence, and relatedness for optimal motivation and well-being. By understanding SDT, individuals can enhance their motivation in various areas of life, including education, work, and personal development, leading to more fulfilling and meaningful experiences. This knowledge will be helpful as you prepare for your CPC exam and explore different theories of motivation and behavior. Sure, let's explore reality therapy, a therapeutic approach developed by psychologist William Glasser that focuses on personal responsibility and making choices to improve one's life. What is reality therapy? Reality therapy is a form of counseling that helps individuals take control of their lives by understanding their behaviors and making better choices. It emphasizes the idea that our actions are based on our needs and desires, and we can change our behavior to meet those needs more effectively. The main goal of reality therapy is to help people recognize their current behavior, identify what they want, and develop a plan to achieve their goals. Key concepts. 1. Choice theory. At the heart of reality therapy is choice theory, which suggests that all human behavior is driven by the desire to satisfy basic needs. According to Glasser, these needs include survival, basic needs like food, water, and safety; love and belonging, the need for relationships and connection with others; power, the need for achievement and a sense of self-worth; freedom, the need to be independent and make choices; fun, the need for enjoyment and recreation. For example, a student may choose to study hard to achieve academic success and feel a sense of belonging with their peers. 2. Personal responsibility. Reality therapy emphasizes personal responsibility, meaning individuals are responsible for their choices and the consequences of those choices. It encourages clients to acknowledge how their actions impact their lives and relationships. For instance, if someone is unhappy in a job, reality therapy helps them recognize that they have the power to make changes, such as seeking new job opportunities or improving their work performance. 3. Focus on the present. Reality therapy encourages individuals to focus on the present rather than dwelling on the past. It emphasizes what can be done now to improve one's situation and achieve desired goals. For example, a person struggling with anxiety may be encouraged to practice mindfulness techniques in the present moment rather than ruminating on past failures. 4. Identifying wants and needs. In reality therapy, clients are guided to identify their wants and needs. This involves exploring what they hope to achieve and what behaviors may be preventing them from reaching those goals. For instance, a person might realize they want to have better relationships, but are currently engaging in behaviors that push people away, like being overly critical or withdrawn. 5. Planning and commitment. After identifying their goals, clients work with the therapist to create a realistic plan to achieve those goals. This includes setting specific, measurable, and achievable steps, as well as committing to follow through on the plan. For example, someone wanting to improve their social life might plan to attend a social event each week and practice initiating conversations with others. Applications of reality therapy. 1. Counseling and psychotherapy. Reality therapy is commonly used in counseling settings to help individuals address a variety of issues, including anxiety, depression, relationship problems, and addiction. For example, a counselor might use reality therapy techniques to help a teenager who is struggling with peer pressure to make healthier choices and build self-esteem. 2. Education. In educational settings, reality therapy can help teachers and school counselors support students in making responsible choices and improving their academic performance. For instance, a school counselor might work with a student to set goals for their studies and develop a plan to stay organized and focused. 3. Group therapy. Reality therapy can be effective in group therapy settings, where individuals can share experiences and support each other in making positive changes. For example, participants in a support group for addiction recovery might use reality therapy principles to help each other recognize their choices and commit to sober living. 4. Workplace. Reality therapy can also be applied in the workplace to improve employee motivation, teamwork, and communication. Managers can use these principles to foster a positive work environment. For example, a manager might encourage team members to take responsibility for their roles and collaborate on goals to enhance productivity. Conclusion. In summary, reality therapy is a practical approach that helps individuals understand their behavior, take responsibility for their choices, and make positive changes to achieve their goals. By focusing on personal responsibility, present actions, and effective planning, reality therapy empowers people to create fulfilling lives. Understanding reality therapy will be valuable as you prepare for your CPC exam and explore different therapeutic methods in psychology. Sure, let's explore 3 important therapy techniques: paradoxical intention, systematic desensitization, and counterconditioning. Each of these techniques is used in different therapeutic contexts to help individuals overcome fears or change unwanted behaviors. Un paradoxical intention. Paradoxical intention is a technique used primarily in therapy to help individuals overcome anxiety or fear by encouraging them to intentionally engage in the behavior they're trying to avoid or control. The idea is that by facing the fear directly, it can help reduce the anxiety associated with it. How it works. The therapist guides the client to deliberately exaggerate their fear or anxiety. This can create a sense of freedom and reduce the pressure to perform perfectly or avoid the fear. The goal is to help the individual realize that the fear may not be as overwhelming as they think. Example: imagine someone who has a fear of speaking in public. Instead of avoiding speaking altogether, the therapist might encourage the person to practice deliberately stumbling over their words or making mistakes while speaking. By intentionally doing the very thing they fear, the pressure is lifted and they may find it easier to speak without anxiety. 2. Systematic desensitization. Systematic desensitization is a technique often used to help individuals overcome phobias or intense fears. It involves gradually exposing the person to the feared object or situation in a controlled and systematic way while teaching relaxation techniques to reduce anxiety. How it works. The process usually involves 3 main steps. 1. Relaxation training. The therapist teaches the client relaxation techniques, such as deep breathing or progressive muscle relaxation, to help them remain calm. 2. Creating a fear hierarchy. The therapist helps the client create a list of situations related to their fear, ranked from least to most anxiety-provoking. 3. Gradual exposure. The client is then gradually exposed to each item on the hierarchy, starting from the least fearful situation while using relaxation techniques to manage anxiety. Example: for someone with a fear of dogs, the hierarchy might start with looking at pictures of dogs, then watching videos of dogs, followed by being in the same room as a calm dog, and finally petting a dog. Each step is practiced until the person feels comfortable before moving on to the next stage. 3. Counterconditioning. Counterconditioning is a technique used to replace an undesirable response to a stimulus with a more desirable one. This is often achieved by pairing the fearful stimulus with something that elicits a positive response, helping to change the person's reaction. How it works. The therapist identifies the undesirable response and pairs the feared object or situation with a positive experience or feeling. The goal is to create a new, positive association with the stimulus. Example: if someone has a fear of cats, the therapist might have them spend time with a calm and friendly cat while providing treats or engaging in a fun activity. Over time, the person learns to associate the presence of the cat with positive experiences rather than fear. Summary of techniques. Paradoxical intention encourages individuals to intentionally face their fears to reduce anxiety. Systematic desensitization gradually exposes individuals to feared situations while teaching relaxation techniques. Counterconditioning replaces negative responses to a stimulus with positive experiences. Conclusion. In summary, these 3 therapy techniques, paradoxical intention, systematic desensitization, and counterconditioning, are effective methods for helping individuals overcome fears and unwanted behaviors. By understanding these techniques, you can better appreciate how therapists work to help clients achieve emotional well-being and personal growth as you prepare for your CPC exam. Sure, let's explore some important therapeutic concepts that are commonly used in counseling and psychotherapy. Here and now: transference, countertransference, catharsis, and reinforcement. Each of these concepts plays a significant role in understanding how therapy works and how clients and therapists interact. 1. Here and now. Here and now refers to focusing on the present moment during therapy sessions. This concept encourages clients to explore their current thoughts, feelings, and behaviors rather than dwelling on the past or worrying about the future. How it works. By concentrating on the present, clients can gain insights into their current experiences and how they affect their emotions and actions. This can lead to greater self-awareness and real-time problem solving. Example: if a client feels anxious about an upcoming event, the therapist might encourage them to identify and express their feelings in the moment, helping them understand and manage their anxiety instead of getting lost in past experiences or future worries. 2. Transference. Transference is a phenomenon that occurs when clients project their feelings, thoughts, and attitudes from past relationships onto the therapist. This can happen because the therapist may remind the client of someone significant in their life, such as a parent or friend. How it works. Transference can help reveal unresolved issues from the client's past and provide opportunities for healing. The therapist can help the client recognize these feelings and explore their origins. Example: if a client begins to feel angry at their therapist for setting boundaries, they might be transferring feelings they have about a strict parent. By discussing these feelings, the therapist can help the client understand and work through their emotional responses. 3. Countertransference. Countertransference occurs when therapists project their own feelings, thoughts, and attitudes onto their clients. This can happen when a therapist's personal experiences or emotions influence their reactions to a client. How it works. While it is important for therapists to remain professional, recognizing countertransference can help them understand their own reactions and maintain a healthy therapeutic relationship. It can also provide insights into the client's experiences. Example: if a therapist feels overly protective of a client who reminds them of their younger sibling, they might need to be aware of this feeling to ensure it doesn't interfere with the therapeutic process. Discussing these feelings with a supervisor or in supervision can help the therapist manage their reactions. 4. Catharsis. Catharsis refers to the process of releasing and expressing strong emotions, often leading to a sense of relief and emotional cleansing. This concept is based on the idea that expressing feelings can help individuals process and heal from emotional pain. How it works. In therapy, catharsis can occur through various means, such as talking about traumatic experiences, crying, or engaging in creative expression. The release of pent-up emotions can help clients feel lighter and more at peace. Example: a client might share a painful memory during a session, allowing them to cry and express their grief. This emotional release can lead to a sense of relief and a better understanding of their feelings. 5. Reinforcement. Reinforcement is a concept borrowed from behaviorism that refers to any consequence that strengthens a behavior, making it more likely to occur in the future. In therapy, reinforcement can be used to encourage positive behaviors and change unwanted behaviors. How it works. Therapists can use positive reinforcement or negative reinforcement to help clients develop new skills or change maladaptive behaviors. Example: if a client is trying to overcome procrastination, the therapist might encourage them to reward themselves after completing a task. For instance, they could allow themselves to watch a favorite show after finishing their homework. Summary of concepts. Here and now focuses on present thoughts and feelings. Transference. Client projects feelings from past relationships onto the therapist. Countertransference. Therapist projects their own feelings onto the client. Catharsis. Emotional release leads to relief and healing. Reinforcement. Strategies to encourage positive behaviors. Conclusion. In summary, these therapeutic concepts, here and now, transference, countertransference, catharsis, and reinforcement, are essential for understanding the dynamics of therapy. They highlight how clients and therapists interact, how emotions are processed, and how behaviors can be changed. Understanding these concepts will help you as you prepare for your CPC exam and deepen your knowledge of therapeutic practices. Sure, let's explore diagnostic classification using the DSM, which stand for the Diagnostic and Statistical Manual of Mental Disorders. This manual is an important tool used by mental health professionals to diagnose mental health conditions. What is the DSM? The DSM is a comprehensive guide published by the American Psychiatric Association that provides standardized criteria for diagnosing mental disorders. It is widely used by psychologists, psychiatrists, social workers, and other mental health professionals. The DSM helps ensure that mental health diagnoses are consistent and based on specific criteria, which is important for effective treatment and communication among professionals. Key concepts. 1. Diagnostic criteria. Each disorder listed in the DSM has specific diagnostic criteria that must be met for a person to receive that diagnosis. These criteria outline the symptoms, duration, and severity required for diagnosis. For example, to be diagnosed with major depressive disorder, a person must experience symptoms such as sadness, loss of interest in activities, and changes in sleep or appetite for at least 2 weeks. 2. Classification of disorders. The DSM categorizes mental disorders into different groups or classes based on similar characteristics. This classification helps professionals understand the nature of the disorder and guide treatment. For example, anxiety disorders include conditions like generalized anxiety disorder, panic disorder, and social anxiety disorder, all of which share features related to excessive fear or anxiety. 3. Multi-axial system. In previous editions, like the DSM-4, the manual used a multi-axial system, which assessed patients across 5 different axes to provide a more comprehensive understanding of their mental health. Axis I, clinical disorders. Axis II, personality disorders and intellectual disabilities. Axis III, medical conditions that may affect mental health. Axis IV, psychosocial and environmental factors affecting the individual. Axis V, global assessment of functioning, which rates the person's overall functioning on a scale. Note, in the current edition, the multi-axial system has been replaced with a more integrated approach. 4. Cultural considerations. The DSM emphasizes the importance of considering cultural factors when diagnosing mental disorders. This includes understanding how cultural background can influence the expression of symptoms and the interpretation of behaviors. For example, a symptom that is considered a mental health issue in one culture might be viewed differently in another culture. Mental health professionals must assess individuals within the context of their cultural backgrounds. 5. Changes and updates. The DSM is periodically updated to reflect new research and changes in the understanding of mental health. The latest edition, the DSM-5, was published in 2013 and includes significant changes from previous editions. For example, the DSM-5 combines some disorders into a single diagnosis called autism spectrum disorder to reflect a better understanding of these conditions. Importance of the DSM. 1. Standardization. The DSM provides a consistent framework for diagnosing mental health disorders. This standardization helps ensure that different professionals interpret symptoms similarly and provides a common language for discussing diagnoses. 2. Guidance for treatment. By identifying specific disorders and their criteria, the DSM helps mental health professionals develop appropriate treatment plans tailored to the diagnosed condition. For example, knowing a patient has generalized anxiety disorder might lead a therapist to recommend cognitive behavioral therapy, which is effective for that condition. 3. Research and statistics. The DSM is also a valuable tool for research. By providing standardized criteria, it allows researchers to study mental health disorders systematically, contributing to the development of new treatments and understanding of these conditions. Conclusion. In summary, the Diagnostic and Statistical Manual of Mental Disorders is a crucial resource for diagnosing and classifying mental health disorders. It provides clear diagnostic criteria, categorizes disorders, considers cultural factors, and is regularly updated to reflect current understanding. Familiarity with the DSM is essential for mental health professionals and is important as you prepare for your CPC exam and explore the complexities of mental health diagnosis and treatment. Sure, let's explore nosology, which is the branch of medicine that deals with the classification and naming of diseases and disorders. What is nosology? Nosology is a scientific system for classifying diseases and medical conditions. It helps healthcare professionals organize and understand different illnesses, making it easier to diagnose and treat patients. The term comes from the Greek words nosos, which means disease, and logos, which means study or science. So, nosology is essentially the study of diseases. Key concepts. 1. Classification. Nosology involves categorizing diseases based on specific criteria, such as their causes, symptoms, and effects on the body. This classification helps doctors and researchers communicate more effectively about different health conditions. For example, diseases can be classified into categories like infectious diseases, chronic diseases, and mental disorders. 2. Diagnostic criteria. Each disease or disorder in nosology has defined diagnostic criteria that help healthcare professionals determine whether a patient has a specific condition. These criteria often include a list of symptoms, lab results, and medical history. For example, the criteria for diagnosing diabetes might include elevated blood sugar levels, increased thirst, frequent urination, and fatigue. 3. International classification. Nosology is often standardized through systems like the International Classification of Diseases, which is published by the World Health Organization. The ICD provides a common language for reporting and monitoring diseases globally. For instance, the ICD-10 contains codes for thousands of diseases, making it easier for healthcare providers to record and share information about patient diagnoses. 4. Evolution of classification. Nosology is not static. It evolves as new research and understanding of diseases emerge. For example, as scientists learn more about the genetics of certain conditions or the effects of environmental factors, classifications may change. A historical example is how mental health disorders have evolved from being viewed as purely psychological issues to understanding them as complex conditions influenced by biological, psychological, and social factors. 5. Importance of nosology. Improved diagnosis. By providing a clear framework for classifying diseases, nosology helps healthcare professionals make accurate diagnoses. Guided treatment. Understanding the classification of diseases allows doctors to choose appropriate treatments based on established protocols for specific conditions. Research and public health. Nosology aids in research by standardizing definitions, which can lead to better understanding and treatment of diseases. It also helps in tracking disease outbreaks and trends in public health. Examples of nosology in practice. Cancer classification. Cancers are classified based on the type of tissue they originate from and their behavior. This classification helps determine treatment options and prognosis. Psychiatric disorders. In mental health, disorders like schizophrenia and bipolar disorder are classified based on specific symptoms and criteria outlined in manuals like the DSM. This classification helps mental health professionals provide appropriate care. Conclusion. In summary, nosology is the study and classification of diseases and disorders, helping healthcare professionals diagnose and treat patients effectively. It involves organizing diseases based on specific criteria, using standardized systems like the ICD, and evolving with new scientific knowledge. Understanding nosology is essential for anyone studying health sciences, as it underpins the way we understand and approach medical conditions in practice. This knowledge will be beneficial as you prepare for your CPC exam and explore the complexities of diagnosing and treating various health issues. Sure, let's break down the topic of statistics by focusing on two important concepts: the t-test and type 1 errors. These concepts are commonly used in research and data analysis, especially in psychology and other social sciences. What is statistics? Statistics is a branch of mathematics that deals with collecting, analyzing, interpreting, presenting, and organizing data. It helps researchers make sense of numerical information and draw conclusions based on their findings. 1. T-test. A t-test is a statistical test used to determine if there is a significant difference between the means of two groups. It helps researchers understand whether any observed differences in data are likely due to chance or if they reflect a real effect. Types of t-tests. There are three main types of t-tests. 1. Independent samples t-test. This test compares the means of two different groups that are not related in any way. For example, you might compare the test scores of two different classes of students. Example: if Class A has an average score of 85 and Class B has an average score of 75, an independent samples t-test can help determine if this difference is statistically significant. 2. Paired samples t-test. This test compares the means of the same group at two different times or under two different conditions. It's often used in before and after studies. Example: if you measure the weight of a group of people before and after a diet program, a paired samples t-test can help assess whether the diet had a significant effect on weight loss. 3. One sample t-test. This test compares the mean of a single group to a known value or population mean. It assesses whether the sample mean differs significantly from that value. Example: if the average height of adult males in a city is known to be 70 inches, you can use a one-sample t-test to determine if the average height of a sample of adult males from that city is different from 70 inches. How the t-test works. The t-test calculates a t-value, which tells you how much the groups differ relative to the variation in their scores. The larger the t-value, the more likely it is that the difference between the groups is significant. After calculating the t-value, you compare it to a critical value from the t-distribution table to determine if the difference is statistically significant. 2. Type 1 errors. A type 1 error, also known as an alpha error, occurs when a researcher concludes that there is a significant difference or effect when, in fact, there isn't one. In simpler terms, it's a false positive. Understanding type 1 errors. The significance level is the threshold that researchers set to decide whether to reject the null hypothesis. Most commonly, this alpha level is set at 0.05. This means that there's a 5% chance of making a type 1 error. If researchers find a significant result, they may falsely conclude that there is an effect when there isn't one. Example of type 1 error. Suppose a researcher is testing a new medication to see if it lowers blood pressure compared to a placebo. If the results show a significant decrease in blood pressure, but in reality, the medication has no effect, the researcher has made a type 1 error. This can have serious implications, such as promoting a medication that is ineffective or causing unnecessary concern for patients. Conclusion. In summary, statistics is a crucial tool for analyzing data, and understanding concepts like the t-test and type 1 errors is essential for conducting and interpreting research. The t-test helps researchers determine if there are significant differences between groups, while a type 1 error represents the risk of incorrectly claiming that a difference exists when it does not. Familiarity with these concepts will be valuable as you prepare for your CPC exam and navigate the world of psychological research and data analysis. Sure, let's explore experimental design, specifically focusing on ABA design. This is a common method used in psychology and behavioral research to assess the effects of an intervention or treatment. What is experimental design? Experimental design refers to the way researchers plan and conduct experiments to test hypotheses and determine cause and effect relationships. It involves deciding how to collect data, what variables to manipulate, and how to control for outside influences. What is ABA design? ABA design, also known as a withdrawal design, is a specific type of experimental design used primarily in behavioral research. It consists of three main phases. 1. A phase. This is the initial phase where the behavior of interest is measured without any intervention. Researchers observe and record the behavior to establish a baseline. 2. B phase. In this phase, an intervention or treatment is introduced to see how it affects the behavior. The same behavior is measured again during this intervention period. 3. A phase. The final phase involves withdrawing the intervention to see if the behavior returns to baseline levels. Researchers measure the behavior again without the intervention to assess the effects of the treatment. Key concepts of ABA design. 1. Baseline measurement. The first phase is crucial because it establishes how often or to what extent the behavior occurs before any treatment is applied. This helps researchers understand what the normal level of behavior is. Example: if a teacher wants to reduce disruptive behavior in a classroom, they would first observe how often disruptions occur over a few weeks without any changes. 2. Intervention. In this phase, the researcher implements a specific intervention designed to change the behavior. This could be a strategy, treatment, or program aimed at achieving a desired outcome. Example: the teacher might implement a reward system where students earn points for good behavior, which can be exchanged for prizes. The teacher then observes how this affects the frequency of disruptions. 3. Withdrawal. After the intervention, the researcher withdraws it to see if the behavior returns to the baseline level. This phase helps determine if the changes observed during the intervention were due to the intervention itself or other factors. Example: the teacher stops the reward system for a few weeks and continues to observe the students. If the disruptive behavior returns to the original baseline level, it suggests that the intervention was effective. Advantages of ABA design. 1. Clear evidence of causation. ABA design allows researchers to demonstrate a clear cause and effect relationship between the intervention and changes in behavior. By comparing the baseline, intervention, and withdrawal phases, researchers can see how the intervention specifically influenced the behavior. 2. Flexibility. This design is flexible and can be applied to various settings, such as classrooms, therapy sessions, or clinical practices. It can be adapted to different behaviors and interventions. 3. Simple and easy to understand. The ABA design is straightforward, making it easy for researchers and practitioners to implement and interpret the results. Limitations of ABA design. 1. Ethical considerations. Withdrawing an effective intervention can raise ethical concerns, especially if the intervention significantly improves the individual's behavior or quality of life. Researchers must consider the potential harm of removing a beneficial treatment. 2. Reactivity. The presence of a researcher or the act of measuring behavior can influence how individuals behave. This is known as reactivity, and it can affect the validity of the results. 3. Not suitable for all behaviors. ABA design may not be appropriate for all types of behaviors or conditions, especially those that require longer-term treatment or have complex underlying causes. Conclusion. In summary, ABA design is a specific experimental design used to evaluate the effects of an intervention on behavior. It consists of 3 phases: the baseline, the intervention, and the withdrawal. This design helps researchers establish clear cause and effect relationships, making it valuable in various settings, especially in psychology and education. Understanding ABA design will be beneficial as you prepare for your CPC exam and explore the methods used in behavioral research. Sure, let's explore the concepts of ideographic and nomothetic approaches in psychology and research. These 2 terms describe different ways of studying and understanding human behavior. What are ideographic and nomothetic approaches? 1. Ideographic approach. The ideographic approach focuses on understanding the individual and their unique experiences. It seeks to explore the complexities of a single person's behavior, thoughts, feelings, and motivations. This approach often involves in-depth qualitative methods, such as interviews, case studies, and personal narratives. The goal is to gain a deep understanding of the individual's perspective and context. 2. Example. Imagine a psychologist is studying a patient with anxiety. Using the ideographic approach, the psychologist might conduct detailed interviews to understand the patient's personal history, triggers for their anxiety, and coping strategies. This approach allows the psychologist to tailor treatment specifically to the individual's needs. 3. Nomothetic approach. The nomothetic approach, on the other hand, seeks to identify general laws and principles that apply to many people. It focuses on finding patterns and commonalities among groups rather than individual differences. This approach often uses quantitative methods, such as surveys, experiments, and statistical analysis, to gather data from larger samples. The goal is to establish broad theories and findings that can be generalized to the population. 4. Example. If researchers are studying anxiety across a population, they might use a survey to collect data from thousands of people about their anxiety symptoms and behaviors. By analyzing this data, they can identify trends and develop general theories about anxiety that apply to many individuals. Key differences between ideographic and nomothetic approaches. 1. Focus. Ideographic focuses on the individual and their unique experiences. Nomothetic focuses on groups and general principles that apply to many individuals. 2. Methods. Ideographic uses qualitative methods like interviews and case studies for in-depth understanding. Nomothetic uses quantitative methods like surveys and experiments to gather data from large samples. 3. Goals. Ideographic aims to understand the complexity and uniqueness of individual experiences. Nomothetic aims to identify general patterns and laws that can be applied to a wider population. Strengths and limitations. Ideographic approach. Strengths. Provides rich, detailed insights into an individual's life. Can lead to personalized interventions and treatments. Limitations. Findings may not be generalizable to others. It can be time-consuming and subjective. Nomothetic approach allows for generalizations and predictions about behavior across populations. Findings can be used to develop broad theories and treatments. May overlook individual differences and the complexity of personal experiences. Can sometimes reduce human behavior to mere statistics. Conclusion. In summary, the ideographic approach focuses on understanding individual experiences in depth, while the nomothetic approach seeks to identify general principles that apply to groups of people. Both approaches have their strengths and limitations, and researchers often use a combination of both to gain a fuller understanding of human behavior. Understanding these concepts will be valuable as you prepare for your CPC exam and explore the various ways psychologists study and interpret behavior. Sure, let's explore the concept of a case study in psychology and research. A case study is a powerful tool for gaining in-depth insights into a particular individual, group, or situation. What is a case study? A case study is a detailed examination of a specific subject, which could be an individual, a group, an organization, or an event. It involves collecting and analyzing various types of data to understand the complexities of the subject. Case studies are often used in psychology, social science, medicine, and business to explore unusual or unique cases that may not be easily studied through other research methods. Key features of case studies. 1. In-depth exploration. Case studies provide a comprehensive look into the subject being studied. Researchers gather detailed information about the individual's background, experiences, behaviors, and context. For example, a psychologist might conduct a case study on a patient with a rare psychological disorder, exploring their history, symptoms, and treatment responses. 2. Multiple data sources. Researchers often use various methods to collect data, including interviews, observations, medical records, and psychological assessments. This richness of data helps provide a complete picture of the subject. For instance, in studying a child with autism, A researcher might observe the child in different settings, interview parents and teachers, and review the child's developmental history. 3. Qualitative and quantitative data. Case studies can include both qualitative data and quantitative data to support findings and conclusions. An example could be a case study on a new therapy for depression that includes qualitative interviews about patients' feelings and quantitative measures of their depression scores before and after treatment. 4. Contextual understanding. Case studies consider the context surrounding the subject, including social, cultural, and environmental factors that may influence behavior or outcomes. For example, a case study on a teenager struggling with substance abuse might explore their family background, peer relationships, and community influences. Advantages of case studies. 1. Detailed insight. Case studies allow researchers to gain a deep understanding of complex issues that might be missed with other research methods. This depth of insight can lead to new theories and hypotheses. 2. Exploration of rare cases. They are especially valuable for studying rare or unusual conditions that cannot be easily replicated in controlled experiments. This can lead to discoveries that benefit broader populations. 3. Flexibility. Researchers can adapt their methods as they gather information, allowing for a more organic exploration of the subject. This flexibility can lead to unexpected findings. Limitations of case studies. 1. Generalizability. One major limitation is that findings from a single case study may not be applicable to other individuals or situations. This means researchers must be cautious when drawing broader conclusions. 2. Subjectivity. Case studies can be influenced by the researcher's biases or interpretations. The data collected may reflect the researcher's perspective rather than an objective truth. 3. Time-consuming. Conducting a thorough case study can be very time-intensive, requiring significant effort to gather and analyze data. Example of a case study. Imagine a researcher conducting a case study on a woman named Sarah, who has been diagnosed with obsessive-compulsive disorder. The researcher might interview Sarah to understand her experiences with OCD, including her symptoms, triggers, and coping strategies. Observe her behaviors in different settings, such as at home and work. Review her treatment history, including medications and therapy sessions. Collect quantitative data by using standardized questionnaires to measure the severity of her symptoms over time. By combining these various data sources, the researcher could develop a rich, detailed understanding of Sarah's experience with OCD, which may provide insights into treatment approaches for others with similar challenges. Conclusion. In summary, a case study is a valuable research method that allows for an in-depth exploration of a specific individual or situation. By using multiple data sources and considering the context, researchers can gain unique insights that contribute to the understanding of complex psychological and social issues. Understanding case studies will be beneficial as you prepare for your CPC exam and explore various research methods used in psychology. Sure, let's explore the concept of interviews in the context of psychology and research. Interviews are a common method used to gather information and understand people's thoughts, feelings, and experiences. What is an interview? An interview is a conversation between a researcher or interviewer and a participant. The purpose of the interview is to collect information about the participant's views, experiences, or behaviors. Interviews can be structured, semi-structured, or unstructured, depending on how much flexibility the interviewer has in asking questions. Types of interviews. 1. Structured interviews. In structured interviews, the interviewer asks a specific set of questions in a predetermined order. The questions are typically closed-ended, meaning they require short, specific answers. Example, a researcher might conduct a structured interview with participants about their eating habits, asking questions like, do you eat fruits and vegetables daily? And how many servings do you consume? 2. Semi-structured interviews. Semi-structured interviews have a mix of predetermined questions and open-ended questions, allowing for more flexibility. The interviewer can probe deeper based on the participants' responses. Example, a psychologist might conduct a semi-structured interview with a patient, starting with questions like, can you describe your feelings of anxiety? And then following up with additional questions based on the patient's answers. 3. Unstructured interviews. In unstructured interviews, there is no set list of questions. Instead, the interviewer has a general topic in mind and allows the conversation to flow naturally. This type provides the most freedom for participants to express themselves. Example: a researcher studying life experiences might start with a broad question like, "Tell me about your life journey," and let the participants share their story without interruption. Key features of interviews. 1. Personal interaction. Interviews involve direct interaction between the interviewer and the participant. This personal connection can help build trust and encourage participants to share more openly. 2. Flexibility. Especially in semi-structured and unstructured interviews, the interviewer can adapt questions based on the participants' responses. This flexibility can lead to richer, more detailed information. 3. In-depth data. Interviews allow researchers to gather qualitative data, which includes the participants' thoughts, feelings, and experiences. This type of data is often more nuanced than quantitative data. 4. Clarification and probing. Interviewers can ask follow-up questions or seek clarification on responses, which can provide deeper insights into the participant's perspective. Advantages of interviews. 1. Rich, detailed information. Interviews can provide in-depth insights into participants' experiences and feelings, leading to a deeper understanding of complex issues. 2. Flexibility. The ability to adapt questions and explore topics in more detail can lead to unexpected insights and findings. 3. Building rapport. The personal nature of interviews can help establish a connection between the interviewer and the participant, making participants feel more comfortable sharing sensitive information. Limitations of interviews. 1. Time-consuming. Conducting interviews can take a lot of time, both in terms of scheduling and conducting the interview, as well as analyzing the data afterward. 2. Interviewer bias. The interviewer's style, tone, or assumptions can influence the participants' responses, leading to potential bias in the data collected. 3. Limited generalizability. Because interviews often involve a small number of participants, the findings may not be easily generalizable to a larger population. Example of an interview in research. Imagine a researcher studying the impact of stress on college students. They might conduct semi-structured interviews with several students, asking questions such as, "Can you describe a recent stressful situation you faced in college? How did you cope with that stress? What resources or support did you find helpful?" Through these interviews, the researcher can gather detailed accounts of students' experiences and coping strategies, which can inform future studies or interventions aimed at helping students manage stress. Conclusion. In summary, interviews are a valuable research method used to gather in-depth information about individuals' thoughts, feelings, and experiences. They can be structured, semi-structured, or unstructured, each offering different levels of flexibility and depth. Understanding interviews is important as you prepare for your CPC exam and explore various methods used in psychological research. Sure, let's explore the concept of observation in psychology and research. Observation is a fundamental method used to gather information about behavior and interactions in natural settings. What is observation? Observation is a research method where researchers watch and record behaviors, events, or interactions as they occur in real time. It allows researchers to collect data without interfering or influencing the subjects being studied. This method is especially valuable in psychology because it helps researchers understand how people behave in their everyday environments. Types of observation. 1. Naturalistic observation. In naturalistic observation, researchers observe subjects in their natural environments without any manipulation or intervention. The goal is to see how they behave in real-life situations. Example: a psychologist might observe children playing in a park to study social interactions and play behavior. The researcher takes notes on how children communicate, share, and resolve conflicts while interacting with each other. 2. Controlled observation. Controlled observation takes place in a structured setting where certain variables are manipulated. The researcher controls the environment to observe specific behaviors. Example: a researcher might set up a lab to study how people react to stress. They could create a stressful situation, like a timed math test, and observe how participants behave under pressure. 3. Participant observation. In participant observation, the researcher actively engages in the group or setting being studied while observing behaviors. This approach provides deeper insights into the context and experiences of the subjects. Example, a researcher studying a support group for addiction might join the group as a participant to understand the dynamics and interactions among members. They would take notes on discussions and behaviors while being part of the group. 4. Non-participant observation. Non-participant observation involves observing subjects without becoming involved in the situation. The researcher remains an outsider and does not influence the behavior of those being studied. Example, a researcher might observe a classroom from the back without interacting with the students or the teacher to study classroom management techniques. Key features of observation. 1. Direct data collection. Observation allows researchers to collect data firsthand by watching behaviors as they happen. This direct approach can provide valuable insights into real-world behaviors. 2. Detailed records. Researchers typically take detailed notes or recordings during observations to capture specific behaviors, interactions, and contexts. This documentation is crucial for analysis later. 3. Behavioral focus. Observation is especially useful for studying behaviors that may not be easily captured through surveys or self-reports. It provides a more accurate picture of how individuals act in various situations. Advantages of observation. 1. Rich contextual data. Observation provides in-depth and contextual data about participants' behaviors in their natural environments, which can lead to a better understanding of complex social interactions. 2. Identifying patterns. Researchers can identify patterns and trends in behavior that may not be apparent through other research methods. This can inform further research or interventions.